Welcome to the July 15th, 2024 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jennifer Maynard.
Jen Maynard, present.
Dan Finn.
Dan Finn here.
And Bill Muller.
Bill Muller here.
All right, and then staff and anticipate speakers on the agenda. When I call your name, please respond in the affirmative. Amelia Houghton.
Amelia Houghton here.
Devon Thornton.
Devon Thornton here.
Ian Wong.
Ian Wong here.
Cherry Tangri.
Cherry Tangri here.
And then Beth Cultura.
Beth Cultura here.
All right, let me just make sure there's no one else that I missed on here. Nope. Okay. All right, I'd like to open the meeting. Can I get a motion to open the meeting from one of the board members? Dan?
This is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Bill Muller. I'll second that.
All right, and then all in favor, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. This Act includes an extension until March 31st of 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020, executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. This meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computers because, as we all know by now, anything you broadcast can be captured by said recording. Before we turn to the first item on our agenda, just going to cover a few basic ground rules, introducing any speakers for any topics. Then once the speaker's done, I'll invite the board members if they have any questions, comments, motions to make. As always, please identify yourself by name when speaking, and then any votes that are taken during this meeting will be done by roll call vote. So that is it for our little notes at the beginning. So I just want to, before we jump into our first meeting topic, just wanted to thank Austin Magnant, who served for a number of years on the board. He decided, due to a variety of reasons with work, etc., that when his time came up for reappointment, he chose not to get reappointed, understandably with everything that he has going on in life right now with work and family, etc. But did want to send our great appreciation to him for the years of his service on the board. And if something changes, as I mentioned to him separately, if something changes down the line in life, and he wants to, potentially get reappointed when there's an opening, by all means, we'd be glad to obviously see him back on the board. So I just wanted to get to that before we got too busy in the agenda and then run out of time and not mention it. So the first topic is the Alliance update. So I don't know who wants to jump in first from the Alliance.
I can jump in first.
All right.
To the board, to the chair. This is Amelia. I'm going to give you a quick nursing update. So we're still talking about COVID, and according to the 6-month biannual report, communicable disease report, we show that Grafton reported cases were 77 and in June alone, last month, we had 20 of those cases. So it makes sense in terms of the wastewater analysis. Dr. Hirsch sends out these reports every week. And for the last several weeks, I keep seeing going up next week, still going up next week, still going up. But we're not getting the hospitalizations that we used to get. So cases are going up, but the illness isn't, the severity of the illness isn't. And also keeping in mind, these numbers show like the trends, but they don't represent reality. 77 cases in 6 months, those are just reported cases or people going to the hospital to get tested. Obviously, you know that people test at home and those cases are not reported. So,
I mean, I know 3 people right now that have it, that tested at home and, you know, stayed at home. So yeah, so it just speaks to the fact of like what you're saying, that it's not all the cases by any
Right.
stretch.
and who's going to test and quickly call the state and report it? You know, it's unlikely. So how many cases are out there? We wouldn't have any idea. So moving right along, in Grafton, for the senior center, our nurse Molly, our regional public health nurse, she goes to the senior center once a month and she goes to the housing authority once a month. Actually, the senior center once a month, but she does a file of life clinic and a blood
Mhm.
pressure clinic. So she helps whoever needs help fill out the file of life card so they can put it on their refrigerator. In case of an emergency and they can't speak or they're not able to speak, they can at least provide information to EMS. And that was the point to that, is to have contact information, insurance information, next of kin information, just right there at a glance on the refrigerator. So she's been doing that.
Mhm.
The senior center, the blood pressure screenings, we've been averaging anywhere from 12 to about 22 a month per session. And it goes up and down based on the weather, based on activities and what's going on. So that's pretty steady. And it's always been that way. The Housing Authority Forest Lane, that is a little bit on the low side. It's averages 2 to 5 a month, and sometimes a lot higher. In the winter, it's a little bit higher. So, and that could be due to many reasons. People are not around or, you know, whatever the situation is in the summer. Let's see. Molly is working on bringing vaccine clinics to the senior center and to the schools. So currently she's waiting to talk to the director of nursing for the schools. She's on vacation. And when she tried to reach out, there wasn't anybody in the office, but she's going to keep trying to reach out because we want to make sure that they get all the vaccines that they want. And the pharmacist from Price Chopper will come like she did last year and vaccinate whoever is interested. And we'll work on a sign-up sheet and all of the things that she requires. And we don't, other than helping her coordinate it, she brings everything with her, including staff. And also the senior center, she'll be working with Shannon to see if the seniors want anything. And that could include flu 65 plus, RSV, shingles, not just COVID. So we're working on all of that. And I just wanted to mention, I know that I sent to Nancy and Beth the arborvirus report, and I could include other names if needed, but they are finding West Nile virus and Triple E positive mosquito samples in Massachusetts. And As always, we encourage people to be protective and preventative. And there is the mass.gov arborvirus update site where you can go and you can look at the maps, the risk maps, and what to do for prevention, what's going on for surveillance, how often they test, and when do they spray. Lots and lots and lots of information. But like I said, if anybody else on the board would like those reports, I can include you. But just real quick, to travel vector-borne diseases, as you have been hearing about the chikungunya virus and then the dengue fever virus as well. The chikungunya, there were 15 cases found in the state, even though one was in Worcester County, not in our jurisdiction so far, right? And then, of course, dengue fever, which has been in the news, 61 cases total in the state, 6 in Worcester County, not in our jurisdiction. So it's they're both dangerous if they get to the point where they become severe illnesses, and very important to know how to protect yourself when you're out there. And that's it for all of our tidbits for nursing. And I actually did, Shrewsbury asked for a content piece for their August newsletter. I am sending them, we're just doing the final edition. I sent them like a page and a half of the West Nile virus and Tripoli and how to protect yourself blurb for their newsletter, prevention tips. So if that's something that Grafton's interested in, I can send it to you guys as well to post anywhere.
I think it'd be good to have. I mean, every year it doesn't hurt to put it out there and remind people. You know, we try to remind people, but it doesn't. Extra education is not a bad thing.
Yeah, I can send it to Nancy and Beth, and they can properly disperse it to whoever. So I think that's it, unless anybody has any questions. We haven't had any outbreaks and no other communicable disease to speak of where it would be more than one case in the last month. So that would be about it.
Dan?
Thanks, Amelia. Just one question regarding the COVID cases. I know of about 9 or 10 local folks, and almost every one of them have been traveling on a plane. And so I think a precaution should go out to wear a mask on planes or in lines at the airport. But do you have any statistics or ideas how many of the folks acquire COVID while traveling?
While traveling, no.
Like air travel?
Yeah, no, that's a good question.
Okay.
Because people who don't know they have COVID wouldn't wear a mask on a plane, and then, you know, one thing leads to another.
Right.
Yeah,
Okay,
you're right. A travel kind of advisory for COVID.
thank you.
We can add that to the list.
Yeah, I'll say, like, I know when I was traveling recently with my mask on, it was like the rarity, shall we say, to be one of the people wearing a mask still while in the airport, airplane, etc. All right, if there's nothing else for Amelia, who wants to go next from the Alliance?
Yeah, if I could, Madam Chair,
Sure.
to the board. I think a lot of you know Cherry from the tobacco, and I'd just like to introduce her and let her talk a little bit, that she's now our share coordinator, taking Karina's place. And I think that's the last time I'll say she took Karina's place, because now she's the share coordinator. So Cherry, I don't know if you want to add anything as you shift into this new role.
So yeah, nothing much to add, but just something what I want to add is I'm still the tobacco contact person until we hire a new or someone new on board. So I will be still handling everything in the Alliance towns. So
That answers my question, because that was gonna be my first question when I heard the news.
Yeah.
Like, okay, now what?
But that means we get to see you even when there isn't a violation, right?
yes.
Congratulations.
Yeah, sure. You don't get the new job until your former job's replaced. So this comes along with you.
We'll take it. We'll take her.
Well, congratulations.
Thank you.
Shall I go next?
Sure.
Okay. All right. Good evening, everyone. I guess I'll start with the complaints. So we've had, well, since July 2nd, 3 complaints in Grafton. The first complaints was with a tenant that had a stove red tag. It was a gas on gas stove that was red tagged because of a gas leak. I've been working with the tenant and the property management. They're in a process of they've already removed the stove. They're replacing the stove. It's probably done. I'll find out tomorrow. The second complaint was on Creeper Hill Road. Like around 72 Creeper Hill Road. The situation is some clothing recycling bins. They're overflowing. We're currently trying to get in contact with the owners of those bins. It's Blue Planet Recycling Company. For some reason, every time we call, the voicemail is full. We can't leave any contact information. When we check online, they're located in Canada, so we're not quite sure what we're gonna do next. I'm gonna speak to Cindy at the administrator's office tomorrow. We're trying to avoid having the property owners remove these items. So hopefully we get that taken care of as soon as possible. The third complaint was a tenant that lives next door to Bushel and Packs. They're complaining about the AC. They're saying that it's too loud. So right now we're collaborating. We're trying to collaborate with the building inspectors to do a ambient decibel noise sound test, just to make sure it's not above ordinance. And if it isn't, then it's not really an issue. So we're working on that. We've had 12 food inspections this month. A host of one-day food trucks that were at the farmers market event. Also, I'm sure, has everyone received the information? The Title V information and everything? I don't want to just read everything off.
Yeah. If it was in the report that Beth pulled together and everything.
Okay, okay, well, we've done. So there's been multiple Title V inspection reviews. I've been with Phil at a few soil testing and plan reviews and Title V inspections. We're currently continuing to permit temporary permits for any temporary event in town. And
Nope, you just went on mute.
that's everything from the environmental health side. Thanks.
See, Jen's got her hand up, virtual hand.
My virtual hand, thank you.
Okay.
I just was wondering, I don't know if anybody knows this answer, but the bins, the clothing and book and shoe donation bins, how do those land where they land? Does like the property owner authorize those? Because I see there's a variety of companies that have them in town. And I see a lot of people sort of posting virtual online and things at certain locations. There's like people are putting trash there or they're overflowing. So I was just wondering, like, how do they land here? Do we have any control over that or?
And I'm almost sure that the property owners have given the permission. And these bins are permitted. So,
Sure.
but these two bins, the permit that's on them came from the town of Millbury.
Hmm.
When I contacted Millbury, they have no information about that particular permit, but it was given in 2019. So tomorrow I'm gonna go see if I can speak with the owners of that particular business tomorrow
Okay.
to see if they have any more information that could help us remedy it as soon as possible.
That's helpful. I always wondered that just because
Yeah.
it's like some businesses, I don't know if they're more engaged with the place or not. But that is something that seems to people flag a lot, not necessarily to the Board of Health, but as I said, you see things online and when you drive around town, you see it. So might be something we want to, do they have to get permitted every year or is it just like once and done?
And it's every year, and usually you're permitted within the town that the bin is in, which is interesting. Yes.
That would make sense.
So I'm hoping to speak with the owners of the property and if they have the contact information to just have this company remove the bins totally
Yeah.
to avoid this situation happening again.
Helpful. Thank you.
Can I ask a question about that?
Yeah.
So I was wondering, is there a cap on such permits like our like who anybody can come and apply? How does it work with these?
And which, my add-on question to that is which department in towns oversees that?
Yeah.
Permitting. And knowing it might be different by town also.
Definitely. And I think usually, well, interesting. So I'm gonna find out tomorrow. I'm not sure. It may be Department of Public Works, or it may be the. I'll speak to Cindy tomorrow, but I think it might be Department of Public Works. Usually, I think with the city, it's inspectional services. They actually give the permits for all trash haulers, clothing bins, porta potties, everything. In Millbury, it's actually the Board of Health that supplies the permits. So I found out about Grafton.
Yeah.
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 Because we might
And
want
I
to.
was say-
We might want to talk to them about like how often are they checking them, as well as like, do we want to consider, I don't know, US based bins versus, or at least more locally? Because I know like Worcester has a few different organizations through Worcester, just so that it's a little easier. I mean, not that the goods can't go wherever they donate for, but just for administrative ease, perhaps, and oversight. Something like that. We might want to talk to if DPW is the one that's doing it in town, so we have some collaboration with them. If you're going to be getting phone calls as such.
Well,
Okay,
yeah,
so
I was gonna say, because it's rare, like I know it's not through the Board of Health in town, here at least, for these bins. And this is the first time I can think of that it got to the point where it's like a complaint to the health department. I too have seen things online where people are like, it's overflowing, stop throwing trash in the bin, but never to the point that I can recall it coming to us as a department for assistance.
It's pretty bad for Grafton, definitely. I mean, it's like someone emptied out part of their garage on this property. Yeah.
I mean, usually you don't see it to the extent I saw some pictures of it. You don't see it to that extent.
When they
But I'll
start,
find out as much information as I can tomorrow.
be great.
Yeah, and Madam Chair, if I can add one piece too as an aside. This morning we had a team meeting at the Worcester Health Department. And one thing we talked about is doing a review of all the ordinances in the towns to make sure we understand who is permitting, who's is in charge, and because it can be a little confusing. I think in a lot of times too, sometimes the Board of Health and Health Department becomes a catch-all. When people don't know where to go, it becomes there. And and people are willing to let the health department take over anything. So yeah, we had, right, because Devon, I think Cherry, we were on this meeting this morning discussing about reviewing the ordinances.
I think that's good, because if people don't know where to call, at least if they can call somewhere and we can help get answers. And of course, when there's overflow, who knows what's in bags, you can get rodents and all those
Yeah.
things. So, there's always some general overlap anyway, so.
But yeah, it'd be good for everyone to know, because if someone asked me, I don't know. I know we don't permit them. That's all I know. Who does? I don't know. So yeah. Well, it's like, you talk to people, it's like, oh, the Board of Health, and it's like, you list off the different things. They just, people who aren't aware of it are like, they just think we deal with just like COVID and nursing. And it's like, oh no, there's septic, and there's this, and there's that, and there's the trash, and oh. So yeah, those we at least all know about, though. But yeah, that's the average Joe doesn't know that like the Board of Health is responsible for some of this stuff in towns, which is fine. Is there anything else for the Alliance for questions from the board members? If not, I think for Cherry's sake, we can maybe jump on the agenda and do the tobacco violation for 87 Worcester Street versus having that at the very end, because it got added on at the very end. So at least if you have somewhere else to be, or we don't have to wait till the very end.
Yeah, that's fine. Actually, I'll be attending the whole meeting, so that's okay. I can still speak, but if you want to just go by the agenda, that's fine too.
I'm fine if we just jump to that one first, and then we can finish up from there afterwards.
Okay, yeah, sure. So Cherry Tangri, I conducted a youth compliance inspection at 87 Worcester Street, July 9 at 12:27 p.m., which was the sale time. So after the inspection, the intern gave me all details of the sale and a description of the clerk. And then the clerk sold a pack of Marlboro Red cigarettes to the intern. So once the intern also mentioned that the clerk did not, he asked for an ID before the sale. When the intern denied having it on him, the clerk regardless made the sale. After all that, I went inside and made sure I spoke with the manager, who was wearing a uniform, and the clerk was actually, they told me that he was visiting them and was randomly available in the store to help them out. And while the manager he went to do a chore outside the store, the clerk, their friend or whoever, the clerk, in that moment, he made the sale, which does not matter. So I came back, and then I asked Beth for the owner's details, and what I was given, I called at that number. Turns out they were the old owners. The old owner then forwarded the voicemail to the current owner, which is the new owner. So it was after work hours that person left a voicemail and a phone number. Next morning, I went back and called the owner, and he was like, yes, we are new people, we took over. Why did you call the old people? I was like, turns out the health department does not have that information. So what's going on? So then I told him the incident, and then he was like, oh, I'm worried now. Why don't you come to my store and do an inspection? And I was like, how are you even operating if you are new owners, an inspection is mandated, you know, pre-opening inspection is mandated. So the same day I went to do an inspection and provided him all the signage and regulations in hand, and I also forwarded him an email about all of these things. So looks like the owner was confused. He thought they had the permit, they could not find it online. So all this triggered a memory that they had reached out to Beth and Nancy, who forwarded me an email saying that they are a change in membership. And that was the whole confusion, that they said we are not new owners, we are a change in management, which to me is separate. And now later on, we find out they're actually new owners. And to add to the confusion, they are just the owners of the store and not the guests. So now it is all crazy. So, and since they were operating without a permit, and also sold to the minor, I think I would recommend that we make it all, like the board makes it all one incident, and go ahead and give them a fine for $1,000. And as the board had voted for a 3-day permit suspension, which is by state law required for the first time sale to minor, so that we also be given to them. And I had sent out the letter for review as well. Yeah, that's it from me.
Not confusing at all with the whole ownership management piece of it on top of everything else. Any questions, comments from board members? Jen?
I was wondering how you knew that they sold to a minor, unless you were behind the how you did that, how that went, or unless you were behind inspecting as they were doing it. I just of note, I mean, I think as we've done before, and new ownership or not, that's a pretty significant, or whomever is manning the store, it's a pretty significant thing. I do want to just note that they also are a store that has very clear signage that they have the lowest prices of cigarettes in the area. So if they're going to, and I think they had were they the ones with the old owners, the flavored papers too, at one point? Maybe not.
I don't
Maybe
think
not.
so, but don't quote me on that.
Yeah, don't quote me either,
Yeah.
but they do have signage that is going to attract people that are, younger and probably,
Yeah.
so.
Yes, I saw that. We sell minimum price cigarettes. Yeah, I saw that. Yeah. So I take the interns out, or whoever is helping out with the inspections, they drive all interns, and then we park in a spot where we think we won't be visible. But nowadays, with the gas stations having cameras like all 4 corners, it is sometimes difficult to be out of sight. But I also, like, while I'm parked, I have to be in a site where I'm able to see the intern going in and coming out, because we have been trained that at some point there might have been incidences where some adult might put a cigarette pack in, their pocket or something, just to avoid all those situations. So yeah, we are on site and we see everything, note down everything, and then usually in the Alliance towns, I would go inside and inform the owners, and in this case, I'm glad that I went inside. So yeah, and I did let him know that if there is somebody who is not an employee and has not been trained, it is okay to sell chips or bread, but it is not okay for them to sell cigarettes where it might cost your store a lot of money, a lot of training. I also asked him, sent him the training resources for like how they can train their retailers, and gave him some ideas, because some stores do that, they have their employees sign agreements, and yeah, and they are pretty stringent. Most gas stations, they fire their employees right away. Not that he wasn't an employee, not that I'm saying that they should do, but these are some, you know, avenues that employers can be using to just be strict.
And do you have to be a certain age to sell cigarettes to someone like you do alcohol?
No, actually, this is funny. If it's a honey farm or a gas station, anybody can be behind the counter and sell. There is no really an age to sell, but to purchase, unless it's an adult-only establishment. Yeah. There they have to be 21 to work, to sell, to even enter.
Sure, that makes sense.
Yeah.
Thank you.
Any further questions or comments from the board members? And then I'm assuming, thankfully, we don't have to deal with this that frequently, that we'll do the typical like motion, second roll call vote in terms of like, are we going to go down the path of the fine and the suspension, treating it as one incident? Dan?
Yes, I'd like to make a motion that we follow the advice of the Alliance on this regarding the fine and the suspension in this case.
Second.
Roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Then Maynard, aye.
Karen Gwiazdowski, Govin, aye. All right, motion passed. Thank you,
I just
Beth
want to,
and Jerry, for dealing with all of that and pulling all the pieces of the puzzle together, more pieces than expected. Dan?
and I just want to mention as an aside, I do think that they were negligent in the transfer of the ownership, not pursuing the proper permitting. And, you know, if they want to take it up with the old owner regarding the fine or whatever, that's up to them, but just my personal opinion.
Agreed.
All right, thank you. All right, so we can move on. COVID-19 updates we already touched on with Amelia, so no need to revisit that again. I know we always have it as a separate topic, but I know like 99% of the time now, since things have not been a pandemic declared anymore, we just cover it as part of the Alliance update, but we keep it on there in case. And that way also, if someone's looking at the agenda, it helps remind others that COVID is still there. Opioid settlement funds.
Okay, I'll take that, Madam
All
Chair.
right.
And, you know, Dan, Bill, and Cherry, please jump in. So let me add one piece. So I've been, since Karina left, I took it over and they'll be transferring back to Cherry. So she'll be running it and I'll still be back there assisting. So one thing we're doing right now is we're looking for, and Beth, I don't know if you know anything else going on, looking at the transfer of the funds into, I know Solo's looking into that right now with our financial budget group to make a separate entity to hold the funds as we use the money in for the programs that we're doing. And and this will be working with the other Alliance towns, especially paying for something like the opioid coordinator. We'll be working for all 3 towns, and there'll be proportionately monies will be spent in it. So it's not going to be divided by a third. It's proportion of what you have. We'll go there and we'll help coordinate this position. So we'll have a full-time person coordinating the position right now. We've moved our meetings to the second to the last Tuesdays of each month. One thing we're looking at right now is, I know, and I think Dan, you were talking to me about this, or some of the emails, that the chief wants looking for support for implementing the DARE program that the police officers have been using over there. So we're looking at the mechanism to apply for those funds to get that settled up there. And one thing I was talking to Cherry about, I was talking to the group about that, really looking at some of those yearly programs that we do. You know, some will be Narcan training, how many Narcan trainings we'll be doing the year. I mean, I hate to say it, not to spoil anyone's summer, but we're always thinking about fall how we're doing the education in the schools and all that pieces coming up. You know, some of the other events that we know throughout the year. So we have those settled. And one thing we're looking at too is, you know, how do we set up a mechanism that we can look at for mini grants for people in the community? So if someone says, hey, I have a great idea, you know, I need $500 to hold some type of group meeting or something, and we'll figure out who on the board, you know, we'll look at these things, review them, and I think that way we'll get community members involved. And one other piece we're looking at again is working with grandparents of those whose primary kid, you know, children of opioid substance use disorders, how they're dealing with them and with their grandchildren. And the other day too, we had a group come in who talked about recovery houses. And that's one thing we're looking at too, besides doing the primary prevention, also thinking about how do we support those in recovery for long-term. After get, I think the chief has a pretty good program of intervening with people when they overdose and getting them into treatment. And we're also now looking at how do we do that long-term opioid treatment programs, because yes, there's NA and others, but a lot of times, you know, Narcotics Anonymous is a lot better for those who suffering from a opioid disorder. Because, you know, there are different groups and different people in there. And I think that's a summary. I think our meeting's next week. So I don't know if the, yep.
Yeah, thanks, Ian. This is Dan. So, and in addition to the DARE program that the chief would like to continue that has shown success, he's going to come to the next meeting and document what he feels would be helpful in terms of supporting the counseling efforts that they have and the visits and the follow-up to folks that you know, have overdosed. They do a pretty good job. It seems like they have a pretty good setup protocol, but I think he's looking to beef it up a little bit and maybe pay for some overtime for those folks that do visit in counseling situations. So we'll see what that is.
Yeah, Dan makes, oh, sorry, Jen. Oh, Dan makes a really good point, because what we're looking at these funds, like, how do we enhance what's currently being done? Because I say this truthfully, and I've worked with opioids all over the Commonwealth. Grafton's really ahead. They're doing all the right things. You know, this is really great. So that's what we're trying to do, is how do we enhance these and move forward? And the other piece too, I think the chief has a really good hand on those who overdose. And so what we're thinking about using the funds is how do we get to those people sooner? How can we get them? We know what happens if they overdose, and we have eyes on them. We come and work with them. We get them in the program, but how can we get them before that? You know, how can someone say, yeah, I've been using, I need help? You know, so hopefully it doesn't have to come there. And then even before that, how do we prevent those from using in the first place? So I think with these settlement funds, we can really enhance a comprehensive piece. And again, like we said too, besides preventing it, interacting with those who are currently using, you know, having an interaction with those who have overdosed, but also using those who are caregivers. As we talk about those who have that secondhand effect from opioids, be it, you know, parents, be it siblings who don't use, and there's a lot of secondhand effects that impacts the family and relationships really big. So I think you can have a core program that's excellent with the chief. Now how to expand this, and I think it'd be fantastic. So sorry, Jen, didn't mean to take time away.
That's great. Thank you. Exciting work you all are doing. I don't know if I've mentioned this before, but in my more professional hat, there's I've done some work with BSAS and their de-escalation training that they have. So I don't know if there's, you know, anything the chief or Dr. Cummings has thought about for staff that might benefit from any training, that even if it's not necessarily a cost for the opioid funds, if there's some things that we might be able to leverage that exists for staff training. And some of those folks have recovery backgrounds, so they come from that perspective. So just wanted to throw that out there. And then the other thing, and I don't know if you know the answer to this, because this could be another case, but I recently had read about the Supreme Court rejecting the settlement on the Purdue Pharma case. Is that different funding than this funding?
Yeah, I think that's separate funding. I think what they're really going after, from my understanding, is they're trying to go after the Sacklers.
Yeah.
And so Purdue Pharma got dumped on everything, and I think they finally are pushing back saying, you know, these are the ones who really, you know, put it in here and they're, you know, in a way getting away. And this is kind of like my commentary, getting away pretty free-handed off of this, while Purdue Pharma and all them are really the ones getting slapped with the big settlement funds. But I think that's the second part that they're working on right now is, you know,
Okay.
and I think what I understand too, a lot of the attorney generals are discussing it too, because on one side, Purdue Pharma and them saying, let's settle this completely. And some of the attorney generals saying, wait a minute, we got hit harder, a lot harder than what the settlement's calling for. So we wanted to individually be able to sue everybody. I think that's what everyone's trying to straighten out right now. You know, how many times can you sue somebody and, you know,
Right.
who,
So
you
there
know,
hasn't been any like, okay, this is not gonna happen, or
no, I think if anything, from what I'm picking, from what I understand, it's a good move that, I mean, before what a lot of us were afraid of, someone's gonna say, okay, we're gonna give you X amount of dollars, and then we're gonna say, fine, here you go, states, we're gonna, and there's billions upon billions out there, and, you know, they're saying, wait a minute, look at the damage that really has been done in our state and our infrastructures and everything else, so I think right now, from what I'm picking from my colleague, it's a positive thing where we're going.
Yeah.
You know, it's not a scot-free thing, but you never know with
Right.
politics, how it turns.
I do think the funds that we've been talking about have been secured.
Yeah.
And they can't take them away at this point, so.
that's good. That's what I was hoping.
Anything else on the opioid settlement at this point in time? All right, seeing and hearing nothing, then thank you, everyone, for your continued work on this. Greatly appreciated. Partnership on this, and looking forward to seeing it develop even further and further. And we have some great traction already, that much I will definitely say. Next topic, body art fees apprentice. We figured we'd put this back on the agenda in case anyone had a magical answer yet or time to have researched. I know I didn't. In terms of apprentice and whether apprentices actually get paid or anything like that, and how that would potentially impact any fees we wanted to charge specifically to the apprentice side of things. And if not, so be it. We can always table it. But we figured we just rather have it on here, and then if we don't have any additional information, we can table it to the next meeting or push it out 2 meetings, whatever the case is. But that way we just don't lose sight of it and forget all about it. I say,
So we
Devon
table-
looks like he
we
wants to
table it
say
to the
something.
next meeting. Because every time I try to check in Grafton, I mean, West Boylston, they're closed because I'm there opposite days. But I will contact someone in the city tomorrow to find out exactly what goes on in the city, if it's normalized across the board, and I'll.
Yeah, I don't think it's anything urgent, and I say
Yeah.
we should.
Okay.
Yeah, it was more just like anything, it's, do the same thing in my day job where it's like, let's not lose sight of this, because otherwise then it'll be like 6 months down the line and someone will bring it up and be like, oh yeah, no one even remotely thought about it in the past 6-8 months or whatever. But yeah, definitely not urgent by any stretch.
But I do have a question. If the case is that apprentice, let's say for instance in Worcester, are being paid, will we then decide to maybe charge a fee for the apprentice? Or because we the body art establishment in town is asking, because she has I think 1 or 2 apprentices that are looking to come to be added. So if I mean, I could have her, I guess we can have her wait to the next meeting, but was just wondering.
Yeah.
Okay.
This is what we were considering, if we didn't want, they weren't gonna get paid, but if they're getting paid and, a decent rate, then some other communities, I think, are charging a small amount. Sorry, everybody's misbehaving in the background tonight. You see.
All right, thank you. All right, so now we've got permit to operate a biomedical research facility for Cummings School of Veterinary Medicine at Tufts University, 200 Westboro Road. This is pretty much a formality in terms of like the inspection's been done, etc. So it's just a matter of, I think Beth already has the draft permit already typed up and everything. It's just a matter of us going through the motions that, you know, we're pretty much signing it, for lack of another way of saying it, virtually, AKA motion, second, vote, and then it'll actually get signed. So is there a motion, or any, I should say first, are there any questions from any board members on the permit process, etc., before we jump into any type of motions?
Does the permit go annual, go from July 1st till June 30th, probably?
Yeah, normally it is. We had extended it in advance, their current permit, because we knew just meeting timing versus getting the contract for the inspection and everything done, that we were concerned that if we didn't pretty much preemptively go and extend it out to the end of July, that we would run into an issue where it would have expired
Right.
before it could have been actually completed and signed. So, but yes, normally it's July, June.
That being said, this is Dan, and I'd like to make a motion to issue the permit for the biomedical research facility / Cummings School of Veterinary Medicine at Tufts University for the year, the annual permit.
Is there a second?
This is Bill Muller. I second that.
All right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, I.
Karen Gwiazdowski, Govin, aye. All right, thank you. Next up is nominating the FEP representative and alternative. FEP representative. Oh, sorry, before we get there, hold on. I think Tufts is 2 years, not 1 year. I think it's 2 years.
Okay, this is Dan. I'd like to amend that motion.
I'm like,
Or-
hold on.
or a new
It's a rarity.
Right, or make a new motion to renew the permit at Tufts for 2 years.
All right,
I second that.
roll
Dan
call
Finn.
vote for the
Dan.
updated motion.
Bill Muller, aye.
Jen Maynard.
Karen Gwiazdowski, Govin, aye. Yeah, that's one of those oddball ones that's not actually in every year one.
Yep.
We don't have many of those. All right, now back to nominating the PEP representative and alternate. And so I know previous years of late, at least, it's been, I think Amelia's been the primary, and then Dan has graciously been the alternate. So is
I could-
there a motion?
I could do another year if nominated as alternates.
I could definitely do another year.
All right, Jen.
I'd like to make a motion to nominate Amelia Houghton as our FEP representative and Dan Finn as our alternate.
Is there a second?
This is Bill Muller. I second that.
All right, roll call vote.
Jen Maynard, I.
Bill Muller, aye.
Karen Gwiazdowski, Govin, aye.
I abstain, I think.
You don't want to vote for yourself? It's a little awkward.
No, don't want to get in trouble.
Thank you both for your prior and now future / current representation. Appreciate it.
Thank you.
All right. Speaking of more motions and everything, and reorganization of the board, also an annual practice. So we have to, for each of these, as a reminder, each gets a motion, a second, and then a roll call vote. So we have to do chair, vice chair, and clerk. Dan?
This is Dan Finn. I would like to nominate Jennifer Maynard as the chair of the Board of Health for the coming year.
Is there a second?
This is Bill Muller. I second that.
All right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye.
Jen Maynard abstain.
Congratulations, and Karen,
Yes.
thank you for your leadership for the past 7 or 8 years.
Good, thanks.
All right, Dan.
And again, this is Dan Finn. I would like to nominate Karen Gwiazdowski Govin as the vice chair for the coming year of the Grafton Board of Health.
This is Bill Muller. I second that.
Roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski Govin abstain. Thank you. I'm not going anywhere. So
Yeah, I was just gonna say, you can't leave me.
it's like I'm not going anywhere.
Bear with me, all you kind people.
All right, and then clerk, is there a motion for clerk? I'll make a motion. I nominate Dan Finn as clerk for the upcoming year. There a second?
This is Bill Muller. I second that.
Roll call vote.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski Govin, aye.
Thank you
Thank you.
for a new title.
Have you had all 3 of them yet, Dan? Because we might have to make that
Not
happen.
quite.
All right, National Night Out. Dan, I know this was something you wanted to add on here. It's one of your favorite topics when we come to this time of year, so.
Yes, so again, on the 1st July, I think it's the 6th, first Tuesday of August, National Night Out is gonna occur at the Grafton Police Station, and we have a table available. I don't know that we have a lot to give out this year, except for perhaps pamphlets and brochures, about Lyme disease and various other things. The past 2 years, we had been giving out COVID tests. But I'll check with Beth and Nancy to see if there's anything, or maybe we could have a raffle or something like that. And I'm available to do setup and work maybe the first shift from 5 to 6:30 or 7. And last year, Jen took the second shift and the close. Are you still able to do that, Jen? And then Bill, if you'd like to stop by, assist at any. if you're
I'll
not
be on
tra-
the Cape, actually, so I'll be there in spirit.
Oh, we know.
Okay, yeah. So it'll be about sunset, so you can make a toast at sunset to
Yeah, there you go.
National Night Out. But that's all we have.
Can I ask oh, sorry, go ahead, Sherry.
Yeah, I just wanted to add that we were talking about this event this morning. So it is happening in all of our alliance towns and in Worcester at the same time. So there will be staff representation from our division at each of these events. And the good news is we also have giveaways, which we will be bringing with us. So, yeah.
Great. Thank you.
And as much education as we can gather.
We're gonna have to start looking, Dan, for what we want year over year now that we don't have to maybe give away test kits and masks as much. Perhaps.
You can get some mini first aid kits or Band-Aids or something.
Yeah, that'd be fun.
What's the attendance to this event?
It's quite a few. It's hundreds of people, actually. And again, not necessarily because, but they do happen to give away free hot dogs and pizza and hamburgers and table talk pies, and that's supper time, sort of lures a lot of people. But a lot of the law enforcement folks from Worcester, you know, the district attorney will be there, the sheriff's office, and it's well attended. It might be it's gotta be over 1,000, I bet.
And Madam Chair, if I can say, Cherry will be organizing for us. She'll be our
Great.
contact.
Great.
Alright. I'm getting, I don't know if it's my side. It's probably my side. It's pretty choppy. So I don't know if you can hear me.
We can hear you, but you've frozen up a little
You're
bit.
not moving.
Right. Suspended animation, I think they call it.
All right, yeah, everyone looks frozen on my side of things, so hopefully,
You're moving again,
hopefully
Karen.
you can still hear me.
You're moving again.
Okay, good. None of you are moving yet, but at least I can hear some, but it got really choppy for some weird reason. It was totally fine before. It's just my day for tech, obviously, problems. All right. Board membership update was our final discussion topic. I know I haven't heard anything yet in terms of if it's been posted, if it's been, you know, if there's any candidates or anything to fill the 5th spot. So can reach out to find out from, I guess, select board, town administrator side, if there's been anything or not.
And Beth, maybe you can check with Nancy and see what's been done in the past. If it's the Board of Health that puts it in the newspaper, but I guess might as well go right to Evan.
I talked to Cindy and Amber, and no one's even applied for it yet. They were gonna repost it.
Alright. Well, at least there's some info, you know, even if it's no one's applied for it. But that's what, you know, you end up with not as much craziness in the world of COVID that scared away people potentially dealing with COVID and stuff. One or the other. So more to come. At least we have 4 members out of 5. So. All right. Okay, last is minutes. We have 1 set of minutes that was for the June 3rd, 2024 meeting. So like anytime we do minutes, it's a motion, a second, and a roll call.
This is Dan. I'd like to make a motion to accept the minutes as produced and provided for the June 3rd, 2024 Board of Health meeting.
This is Bill Muller. I second that.
All right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Ben Maynard, aye.
Karen Gwiazdowski, Gilpin, aye. All right, there was no additional mail or correspondence that I saw. So that just leaves upcoming meetings. We have August 5th, September 9th, October 7th, November 4th, and December 2nd. Currently all showing as remote only at this point in time. Obviously, if anyone knows of any conflicts, especially where right now we're down a member, kind of like with this one, how we had changed, it was supposed to be earlier in July, but then we changed it due to, you know, I had some travel and work and everything and stuff, so it just made it easier. So we didn't end up with a potential last minute cancellation due to lack of quorum or something if there was ever an emergency for people. So Jen, Bill.
I have so much to say today. Just to flag, so if you go, in case anybody watches this afterwards, on the boards and committees openings, we do have our opening listed on the website. for folks to apply to, everyone's updated on our website, but there's not like something that says on our Grafton Board of Health site that says we have an opening. So that would be good. And then maybe something if they let us socialize that a bit.
Yeah,
Great,
my
Jill.
comment is in the first week of August, I'll be in Brewster. I can certainly try to participate. And not make it look too idyllic in the background. I just go down to the beach and kind of, you know.
There has to be a bench someplace in Brewster that can get the Wi-Fi, so
Yes,
scout that out.
yeah. Do my due diligence in terms of researching that.
All right. There's nothing else. That was all we had for topics and items on the agenda, so. Dan?
This is Dan. I'm getting hungry and thirsty. First of all, I'm up at our lake house, and up until 6:30, there was a wonderful breeze out here, and then it went flat and humid, and I think we're gonna get a thunderstorm. So I would like to make a motion to adjourn this meeting and skedaddle home.
There a second.
This is Bill Muller. I second that.
Dan Finn, aye.
Bill Muller, aye.
Then Maynard, aye.
Aaron Gustowski, Govin, aye. All right, well, thank you, everyone.